Hello viewers, I hope you all are doing great. I'm Professor Asif and today I'm going to talk about hair fall. Hair fall in this present world is a very common problem. You know, whenever we see hair shedding, we get very tensed, very nervous. People get very excited about it. They come to us rushing. There are so many reasons we lose hair. On an everyday basis, normally losing 100 to 150 hair is quite normal, but sometimes the rate increases, and that's where the problem starts. So before talking about the solutions of hair problem, let's first talk about the reasons why we lose hair. Well, there are various reasons why a person can lose hair at any time during his or her life. One is hormonal hair loss, which is called androgenetic alopecia, and this at present world is the commonest cause of hair fall. In this case, we see that men tend to lose hair from both sides of their scalp, which is called bitemporal recession. And for women, they lose hair right from the middle. It's like a Christmas tree inverted. And slowly, gradually, the hair tends to get smaller, thinner, and then there is baldness, which starts from the middle or from the frontal part of the scalp. Then it starts to grow. This is one pattern of hair fall. There are some other reasons of hair fall. One is called effluvium, where the patient loses hair from all over the scalp. And there are so many reasons for this. One being lack of proper diet, lack of proper sleep. Then there are some diseases which are associated with this type of hair fall, namely diabetes, thyroid issue. Sometimes after pregnancy, after surgery, or after fever like typhoid or dengue, we can shed hair like this. Normally, this kind of hair fall is self-reversible. I mean, after a while, they again start to grow hair. But sometimes they need medical attention as well. And then there is another type of hair fall, which is called alopecia areata, where the patches of hair is lost from different aspects of the scalp. And it happens suddenly. I mean, patient comes to us and then they tell that suddenly one fine day or one fine morning, they see that there are bald patches, round bald patches in different parts of the scalp. So these are basically the major types of hair fall. Regarding treatment of hair fall, first we try to assess the reason, and then we try to assess the grading of hair fall. And according to that, there are various kinds of treatment that are prescribed. Initially, we try to prescribe topical medications like minoxidil. And in many cases, applying minoxidil properly for a considerable period of time help patients to grow their hair. But it has to be applied regularly and for a longer period of time. Sometimes patients tend to get very impatient and then they stop applying this medicine after applying for a while, but that is not the proper way of starting it or using it. So you have to follow the instructions given by the doctor and you have to stick to the treatment to get a good result. Sometimes only topical therapy doesn't help. We need to put something extra, something else. We try to sometimes give oral medications like finasteride or some biotin which help grow hair. But sometimes mere medication is not sufficient. In those cases, we add some other therapies, interventional therapies. At present world, in different countries and also in Bangladesh, there are some therapies which are being prescribed and they are giving great results. One such therapy is PRP therapy, which is called platelet-rich plasma therapy, where we take blood out of the vein of the patient, then we centrifuge it and we prepare a substance called platelet-rich plasma, and then we inject it in the scalp after proper precaution and at a certain interval for few sessions. And PRP, having few growth factors, enhance the growth of the hair. And lastly, but not the least, there is one treatment which is also gaining popularity, which is called hair transplant. In short, we call it FUE, or follicular unit extract, where we try to extract follicle from the back of the scalp, which is called the occipital region, and we try to transplant it in front, in the bald area where people have lost hair. And people who are not responding to medical therapy or PRP are good candidates for follicular unit extraction, provided they have got sufficient number of hair at the back of the scalp. But one thing I want to say is that at present world, with these various treatment procedures, managing hair loss treating hair fall is not a big deal. So when you are losing hair, please don't lose hope, don't lose heart. You try to be patient, you consult a doctor and try to get rid of this problem. Thank you very much.